we also know that more Canadians will continue to be lost to COVID going forward, and that's also heartbreaking. But we have to acknowledge the necessity of continuing to move forward. Our current set of restrictions are in place until February 14th. But we're at a stage where Nova Scotia is ready to make gradual changes, and we can make those changes with confidence. Our public health team has been incredible and is incredible. They haven't changed. Dr. Strang hasn't changed. He's the same compassionate, thoughtful, brilliant leader that has led us this far, and he has earned our trust, as has his team. We can have confidence in his guidance. I know I certainly do. So today we will be announcing easing of some restrictions effective February 14th. And we'll also be sharing a plan to continue that easing gradually in phases going forward from there. The reality is that the more we continue to let COVID control our daily lives, the longer we will see the negative impacts, especially on our children and on our seniors. So Dr. Strang will provide more details. But in high level, I guess, effective February 14th, sports, arts, and cultural events can resume. Gathering limits will increase for informal events from 10 to 25. Restaurants and gyms will increase capacity to 75%. Retail can increase capacity back to 100%. Cosmetologists can resume their full services. So all of those things will be effective February 14th, and there will be lots more to say about the moving forward over the coming weeks. We'll have a lot to say about that. But I do want to be very clear about why this is happening, why we are able to ease restrictions, and it's happening because of our high vaccination rates and the fact that we're leading the country in booster doses. These are not things to be ignored. It's also happening because we know the need to balance between restrictions, the risk of COVID in terms of our overall public health. So every step of the way, for 2 years, we have followed the science. And today, and every day, we will continue to be guided by Dr. Strang and the team at Public Health. So as we move forward and Nova Scotians continue to do their part, we also recognize that government has work to do as well. Everything we've done has been to support our healthcare system and make sure that it is there for each of us should we need it for any reason, and that remains the priority today. So we don't have to think too hard to remember the videos of people around the world banging pots and pans on their balconies and on their front doorsteps to show their appreciation and gratitude to our frontline heroes as they rotated through their shift changes. We all remember that. That admiration for our healthcare professionals and frontline professionals cannot change. In those moments, we were together, and we know that to move forward, we have to stay together and work together to take pressure off the system. And that means government has to take some immediate steps to increase healthcare capacity. So I'll say last week, all 13 premiers came together to discuss the state of healthcare in Canada. Everyone is experiencing challenges with their healthcare systems. It's consistent across the country. It is clear that Canada's healthcare system is significantly underfunded. Canada's healthcare system has struggled to meet the needs and treat COVID patients and non-COVID patients at the same time. It's been a struggle. Meeting with the other premiers, I was struck by the comments of one premier who shared a story where a constituent told him, and just said quite simply, for 2 years, I've done everything that's been asked. I'm boosted, I'm vaccinated, I've got my kids home, I've done everything. But she asked him, what has the government done to improve capacity in the healthcare system? And I've reflected a lot on that question, as have the other premiers I know from talking to them. But it's clear that we have more to do as a government. So in Nova Scotia, One necessary step to increasing capacity is working with the long-term care sector to open more beds as quickly as possible. The biggest issue that we have in opening more beds in long-term care is that there's not enough workers. So there are people in hospitals that could be, better cared for in long-term care. There's space in long-term care, but they don't have the staff to open those beds. So this is something that we can do. And the fact that they don't have enough staff is happening at the same time that there are hundreds of continuing care assistants in this province who are trained and amazing at what they do, but they aren't working in their chosen field. And I don't blame them. To every Nova Scotian who might not fully understand the important work of a CCA, listen to Bruce Guthrow's song, What Makes a Hero. Watch the video. It's one of the most useful videos on YouTube. It's powerful. And in that song, Bruce says that a hero is someone who does what needs to be done and needs no other reason. They just do it. So to our CCAs, we know the important work you do. And we know that we have work to show that to you. So this week, our government is taking an important step to reiterate the incredibly important role you play in our healthcare system. You've been underpaid by almost every metric possible to look at it. I heard loud and clear last night on a call with hundreds of CCAs, some of the issues that they're facing, and the compensation was a big part of that. So I want them to know that today, we're taking steps to fix that issue. I'm happy to announce that we will be increasing the pay for every CCA in this province, and we will make Nova Scotia a pay leader with the raises that we're putting forward. So it'll work out to approximately 20 to 25% increase for CCAs. We'll work through those details with you, but it is effective tomorrow. So my message to those of you who have felt undervalued to the point that you left the profession, please come back. We need you now more than ever. We want you, we need you, we value you, and we respect you. If we can get people to return to the industry, it will have a incredibly positive impact and help us with our capacity issues. So I know it's not a silver bullet to everything facing healthcare, of course, but it's one tool, and we're going to do it. So that'll be effective immediately. Before I close and pass it to Dr. Strang, I do want to speak about education. The top line is, from everything that I hear, students are happy to be back in school, and that's very good. Yes, we are still seeing somewhere in the range of 20% students absent. But as one teacher said to me, look at the positive. That means 80% of our kids are attending school, and that's what's important. So like healthcare, our schools are functioning, but the systems are stressed. There's no question about that. So I just ask people, parents and family members and caregivers to please bear with the teachers and educators and the staff as they strive to find the balance between student well-being and student achievement. Just as we have had to adjust our expectations for healthcare, like canceling non-emergency surgeries, we need to do that as well for our other systems as we work through this wave. So please be patient, understanding that we are living through the pandemic, that there are pressures on the systems, and they're bound to have an impact. But the one thing we can never lose sight of is the need to focus on student well-being. So I thank those teachers and educators and people working in the schools for doing just that. But Dr. Strang, good to see you again.
Good to see you in person. A step back, a step of or a show of optimism for folks. So thank you, Premier. And I also want to offer my condolences to the families who have lost loved ones to COVID-19 since our last briefing. This pandemic has taken so much, but none have suffered more than the families who will never see or hug their loved one again. Trying to protect people is what we've been doing for 2 years. It's why we've had restrictions and rules, things that have been frustrating but absolutely necessary. Today, I'm optimistic that things are improving, and I'm confident we are ready to start loosening restrictions. We have passed the peak in our Omicron wave and are seeing declining lab positives and long cases in our long-term care facilities and other settings where we've had outbreaks. The outbreaks are all substantively on decline. Even the number of new admissions to hospital looks like they've reached their peak, but we have to acknowledge that our healthcare system continues to be under tremendous pressure, with bed occupancy over 105%. So we need to do what we can to help ease that pressure. Omicron, while mild for many, especially for children, is more transmissible and continues to have significant impacts on our most vulnerable. That's why we're announcing a phased plan to ease restrictions starting on February 14th. We will continue to carefully balance limiting the impact of Omicron on our most vulnerable in our healthcare system while starting to get back to normal. Restrictions do come with their own set of serious impacts: economic, emotional, and physical. It's been especially hard on children, youth, and the elderly, and there have been many mental health consequences. But here are the things we are looking for as we ease restrictions, and this will help guide us through our phases. Looking to see continuing declining lab positive cases, continued declining hospitalizations and new admissions for COVID, continued decline in cases in long-term care and other vulnerable settings, improvements in our health system capacity and workforce pressures, and continuing to build on our already good already good population immunity from both vaccine coverage and recent infections. These are all important factors that we will consider how and when to further ease restrictions. But based on experience, science, and the proven impact of vaccines, especially against severe disease, I'm confident that we can safely start to ease restrictions. Contrary to what you may be reading and watching about the protests in Ottawa and even here in our own backyard, vaccination is safe and critically important to our ability to ease restrictions. Nova Scotia is one of the leaders in the country in our vaccine uptake, including for children and for those for the percentage who have booster doses. And while vaccine itself may not protect all infections, there is no doubt that it offers substantive protection from serious illness, hospitalization, and death. The situation in our province would have been much, much worse if it were not for our high level of vaccine coverage. And the credit to that goes to every Nova Scotian who's stepped forward and rolled up their sleeve and to get their first, second, third, or sometimes even their fourth dose of vaccine. So while part of me would love to say we're done with COVID and throw the doors of our province wide open, it's my job to weigh the risks and benefits and recommend an approach that continues to protect the most vulnerable and our healthcare system in the least restrictive way possible. I also know that easing restrictions will cause some anxiety. That's understandable. Certainly COVID and this latest Omicron wave has not been easy. We have lost 55 Nova Scotians since December 8th, which is the start of the Omicron wave, and the physical and mental health of countless others has been impacted. But it's time to change our perspective and our approach. We're no longer trying to contain the virus. It's here and likely will be for a long time. Our aim is to prevent serious illness. It's time to accept that we will see ongoing spread as we ease restrictions, but we will also rely on our high levels of immunity to protect us as much as possible from severe illness. So it's time to start the shift towards living with COVID. I won't get into all the details of our plan to ease restrictions. Those will be on our coronavirus website. But I will say that will happen gradually over 3 phases, and we anticipate that each phase will last about a month. This will give us time to monitor how things are going and make adjustments if necessary. At a high level, in phase 1, which starts 12:01 a.m. February 14th, we'll allow events again, increase gathering limits and business capacity limits, and remove border restrictions. And in phase 2, gathering and capacity limits will increase again. And in phase 3, there will be no more gathering or capacity limits, and we will also lift physical distancing requirements. And for now, masks are still required in indoor public places, and proof of vaccination is still necessary for discretionary activities. And we will let our evolving epidemiology guide us when we can safely change these two components. Today, though, I can give some certainty. I'll give you more details about phase one. As I said, it starts 12:01 a.m., February 14th. So in this first phase, the informal gathering limit will increase to 25 people from 10, and they can be from the same household or a consistent social group. Typically, this is for gatherings at people's homes. We will also increase the formal gathering limit to 50% of the capacity of a venue and allow a range of events, again, things like funerals, wedding receptions, festivals, fundraisers, and other special events. Performances and sports games will be allowed, including when they take place as part of school extracurricular activities. And the limit for participants, like players or performers, will increase to 60, and that's for both sports and arts and culture performances and games. Spectators will be allowed, again, following the formal gathering limit. And that formal gathering limit will also apply to regular faith services. Performers like choirs will follow the limit for arts and culture participants, and we recommend that choirs keep their masks on for singing in phase one. Congregations can sing again, but the mask requirement will remain in place for them during phase one. Retail stores and malls can operate at maximum capacity possible with physical distancing. Fitness, recreation, leisure facilities, businesses and organizations can operate at 75% capacity. So this includes everything from gyms and arenas to libraries and museums to dance lessons and dog training. Bars and restaurants can operate at 75% capacity. They will still need to have the distance of 2 meters between tables, and there will be a limit of 25 people maximum at a single table. And they'll be able to stay open 1 hour later, providing table service now until midnight and closing at 1 a.m. They can continue to operate takeout, delivery, and drive-through for later hours, however. And any performers that follow the limits for arts and culture participants, those are performers within a licensed facility. In our public schools, enhanced public health measures such as classroom cohorts and masking will continue, but singing and the use of wind and brass instruments can resume. Schools will now be allowed to resume all extracurricular activities following community guidance for sports, arts, and culture. And in long-term care, the key change is that residents can have now any 2 visitors at a time. We were restricting it to only 2, and they had to be consistent visitors. But as of Monday, they will no longer need to be the same two visitors, but a maximum of 2 at a time. And the visitors must still wear masks and be fully vaccinated, except for end of life and other compassionate visits. I know that this is a lot to digest, and everyone's tired of trying to learn a new set of rules. But this is a major step in the right direction, a step towards some more normalcy in our lives. I want to move on and just give a few key vaccine updates. As of today, adolescents 12 to 17 years old can get a booster dose of Pfizer vaccine, and it has to be at least 168 days after their second dose in their primary series. However, parents, guardians, and the adolescents themselves should be aware that there is limited data on a booster dose in this age group, and there is still the rare risk of myocarditis and pericarditis following vaccination. So the National Advisory Committee on Immunization only recommends a booster dose in this age group, 12 to 17, for those who may be at a higher risk of severe illness, including those who have an underlying medical condition that puts them at increased risk, are residents of congregate living settings, or belong to racialized or marginalized community disproportionately affected by COVID-19. NACI has not recommended a booster dose for all adolescents, given the risk of severe illness is generally quite low, especially for those who have already had their first 2 doses of vaccine. But if your child does not fall into one of the above groups I listed, and you still want to have them give them a booster dose, you can do so, but please review the information that will be available on our online booking site and make an informed choice. We're also implementing 2 other NSLive guidelines that were recently issued. The first is a recommendation that children 5 to 11 who are moderately to severely immune compromised at the time of their first or second dose in their primary series now receive a 3rd dose of vaccine to complete their primary series. Children meeting these criteria are now eligible for this additional primary series dose to ensure they have maximum protection. And again, all the details of who is actually eligible will be on our online vaccine booking site. And the second recent announcement we're adopting is that advice on timing for when to receive a COVID-19 vaccine if you have been previously infected with COVID. If you test positive for COVID-19 and have not been fully vaccinated, NSLive advises you wait for 2 months to get your first or second dose. If you've tested positive for COVID-19 and have already been fully vaccinated, NSLive advises that you wait for 3 months to get your booster dose. And that is provided it's at least 168 days since your second dose and you are actually eligible for a booster. And for people who have already received a dose of vaccine immediately after recovering from COVID infection, you don't need to worry. You do not need to repeat the booster dose. So as usual, I've shared a lot of information in detail, but the bottom line is this: get vaccinated, follow public health restrictions, and follow the personal measures like masking. These steps will continue to protect you and the people around you from severe disease. Nova Scotians have shown extraordinary resilience in the face of this virus, and we're asking for just a little bit more to put this wave behind us and move into the new era of living with COVID. And I want to take a moment and be very clear. The reopening we have just outlined is in no way a response to recent protests. Quite the contrary. It is based on following evolving science this entire pandemic. It's built on our experience and the knowledge of the protection provided by vaccines. This is why we're in a position to start to ease restrictions. And I want to say a tremendous thank you to the vast majority of Nova Scotians who continue to protect each other, take care of each other, and show kindness and compassion for each other. True shared freedom comes from love, caring, and compassion, not from self-centered views, division, and anger. Tina.
Thank you, Dr. Strang. Just a reminder to the reporters that we have on the phone, we'll take 1 question and 1 follow-up in the allotted time that we have for today's briefing. If you're not on mute, and I'm hearing that some of you are not, please ensure that you are on mute. We'll start with Taryn Grant from CBC. Go ahead, Taryn.
Thank you, Tina. My question is for Dr. Strang. I'm hoping you can talk a little bit more about the projected pace of this reopening plan, going at 1 month at a time for each phase. How did you arrive at the decision to go 1 month? And could it actually go faster than that if the epidemiology warrants it?
So absolutely, we will always look at our epidemiology, and if we are able to move faster, we can. But if you look at previous reopenings, we've often maybe gone in 2 or 3 week steps, but we've had more smaller steps. This is quite a large step from where we're currently at, and so we really feel like. And then the next step is another big step in reopening, and then if at the 3rd step, it's at the place where we really are removing all restrictions. So it really is a 3-step approach, and the 3rd step being our end. So given where we're at, we feel we can take those larger steps, but we have to watch them carefully, and we need some time to make sure that we are not putting undue pressure on an already very fragile and stressed healthcare system. And so that's our approach. And I outlined in my remarks the kind of indicators that we are looked at to make the decision today, and we'll continue to look at those. And if we can go a little faster, we'll look at that. But we also are very cognizant of that this needs to be phased over the next couple of months, and we are making sure we're continuing to support our colleagues in the acute care sector who are dealing with tremendous pressures at this time. We ask for people's patience. We will get there. Today feels like spring as I walked over here. And we know spring is not that far away, but it's like winter ending. You can't force it. And so we're going to have a little bit of patience. By the time we get to spring, we will be in a far better place. So let's just work together and be patient for the next couple of months.
Go ahead, Taryn, if you have a follow-up.
Thank you. This one's for the Premier. Premier, I understand that you had a meeting last night with CCAs, and I'm wondering if you announced the pay raise to them last night or if they learned about it with the rest of us just now. And if they did hear about it last night, what kind of reaction did you hear?
Yeah, thank you, Taryn. We had first off, I want to thank the CCAs. We had a great crowd last night, a few hundred of them on and basically it was a listening where they were sharing the challenges of doing their job, and certainly pay was one of the things that it has a big impact on their lives. So we did not announce it last night. We wanted to listen to them last night on a whole suite of issues that they were raising. Minister Adams, the Minister of Seniors and Long-Term Care, had a call, I think, with CCAs just prior to starting this briefing. I think maybe just 2:30 or something, and I think Minister McMaster, the Minister of Finance, was also going to have a chat with some of the unions before the briefing. So they did not learn on the call last night. Certainly, the call last night had a big influence on the decision. I will say that, and we've started to share that information with them today.
Next, we'll go to Callum Smith from Global. Go ahead, Callum.
Thank you. This question is for Dr. Strang. Dr. Strang, I understand hospitalizations have been an important benchmark, and I understand you're saying new admissions have peaked, but we're still at about the 90 level, and that's been the case since late January. I'm wondering how comfortable you are. Obviously, you said you're confident lifting restrictions with this phased approach, but how can we be doing that when hospitalization numbers in total are still essentially flatlined?
So that's why you have to break out the numbers you're looking at, and a basic fundamental principle in epidemiology is the difference between an incident, and those are the new things that are happening, versus the prevalence, which is the cumulative total. So when we look at from the epidemiologic perspective, where are we at in the trend of the wave and the spread of the virus? It's looking at new cases. What are we seeing today in our communities, which is most important? And we are starting to see very early our case numbers and outbreaks and all those things that I outlined are well on their way trending downward, and we're starting to see the beginning of that downward trend in new admissions and hospitalizations. But from the perspective of the capacity of the healthcare system and making sure that we and being cognizant of how much pressure they're under, it's the prevalence, it's the total number of cases that we have to be concerned about. And the two come together when we look at how fast can we go in this reopening, because we have to remain cautious that our system is already at maximum capacity. And so as we reopen, and I'm comfortable that we can reopen, but we have to be careful to watch that we're not adding to that already substantive pressure that's on the healthcare system.
Go ahead, Callum, with your follow-up.
Thank you. Again, for Dr. Strang, I guess if phase 3 is the final stage, how can we be considering still requiring masks and proof of vaccination if phase 3 is the final stage? I guess why was there a chance for restrictions at the time? What will guide? I know you say the epidemiology will guide it, but what are you looking at specifically to lift both those restrictions?
We'll have to look at all the indicators that tell us what's the level of virus activity in community, and we'll make final decisions both on phase 2 and then final decisions on phase 3, and especially phase 3 whether that can include removing the proof of vaccination as well as removing mandatory masks at that time. Based on what happens, we'll watch it on a week-by-week basis over the next couple of months.
Next, we'll go to Jonathan McGinnis from CTV News. Go ahead, Jonathan.
Hi, good afternoon. Thank you very much. Dr. Strang, we've heard you talk about these phases and how we will progress to each one, or we could even go faster. Do you see us going, once we're in a phase, do you see us going backward at all? Is there anything that would prompt that? or are we in a phase until we can move forward?
So there's always the possibility of some new variant or change that I'll never rule that out, right? But I really see that unless there's a very significant unexpected development globally around variants in this virus, we are on a progress that is forward facing, continuing to move in that, and it's not so much about going backwards, but also are we on the right, what is the right timing for the next step in our forward progress?
Go ahead, Jonathan, with your follow-up.
I'm good, thank you.
Great. Next, we'll go to Keith Doucette from the Canadian Press. Go ahead, Keith.
Good afternoon, Dr. Strang. I realize that this approach that you've announced today is probably in keeping with what you've been doing all along. But I wonder, given the situation that's going on in the country, if you could just talk a little bit philosophically about the difference of your approach and, say, the approach of your colleague in Manitoba, a province of similar size and probably with worse numbers than here, yet there's a significant gulf, I think it's fair to say, in what they're doing and what we're now doing here in Nova Scotia. I wonder if you could address that.
So a couple of things. I was on a national call yesterday. We were with my chief medical officer colleagues, and we did a round table. And there's actually a lot of consistency. We're all going within the next couple of months in a very similar kind of sequenced reopening. Some are just going a little faster than others. Each province, throughout the whole pandemic, there's been these variations where different contexts, different decision making. We've never compared ourselves and said, well, we have to follow another province. We've always done what's right here in Nova Scotia.
Go ahead, Keith, with your follow-up.
Yeah. Okay. And one for the Premier on the CCA increase. It's not insignificant. It's rather large when you look at what most public servants have been getting in the last 10 years or so. You have other people to also negotiate with. I mean, are you concerned or not concerned now that you may have to dole out a lot more money across the system than you're doing right now with CCAs, who admittedly have been underpaid for years?
Yeah, thank you, Keith, and certainly we're aware of that situation. But the reality is when you look at where we're at right now with the capacity issues in our hospital system, we need to take steps to address that. And the clearest path that we can see that's within our control is to help move people from the hospital system to the long-term care where that's appropriate, and then we realized, well, there was a problem there because there wasn't enough staff. So CCAs are front and center on this one because they play such a significant role in helping relieve some pressure from the hospital system. But to your point, absolutely. I mean, there's a lot of people in line, and for CCAs, I was quite shocked when I realized that we had some of the lowest paid CCAs in the country. It was just way out of line with what was being asked. So we just have to start there. It's the right thing to do, and that's why we're doing it.
Next, we'll go to John McPhee from the Chronicle Herald. Go ahead, John.
Thank you. This is also for the Premier, and it's also on the CCA pay raise. So it's in the 20 to 25% range. I'm just wondering, how was that determined, and where does that leave us now compared to other provinces? You just said we were very low before. Where are we now?
It'll bring us to the top or close to the top, maybe out in front. So in terms of the range of 20 to 25%, there's a number of factors in different agreements on a number of hours worked per day versus the breaks and lunchtime and all. There's just a number of factors, but the message to CCAs, and certainly the message that was reiterated quite strongly last night in the call with hundreds of them, was that it was time to address that issue, and it was also very clear, and it is very clear, that the underpayment is having a significant impact on our ability to care for our seniors, and having a significant impact on our hospital capacity issues. So it's not insignificant. we're trying to, as a government, as still a new government, we have a lot of issues that we have to kind of catch up on and deal with, and things that have been kind of languishing. We're not in the languishing team. We're in the doing team. So we're getting to work on a lot of these files.
Go ahead, John, with your follow-up.
Thank you. This is for Dr. Strang. In recent news releases, there's been a consistent number of new outbreaks in hospitals and in nursing homes. I'm just wondering, can you give a general overview of what the situation is there, and if that's a concerning thing for you?
Well, I mean, both those outbreaks are a reflection of the level of virus activity in community. So for hospitals, it's, there's a lot of attention being paid to, infection control measures and people, staff wearing personal protective equipment. But it's inevitable that there is going to be, with such an infectious variant that's highly prevalent, that's going to be spread into hospitals. So it's part of what's putting pressure on hospitals. And but those numbers are starting to, they will start to come down as we start to, as they start to reflect the decreased virus activity in communities. The same thing in our long-term care facilities but we're actually, when you look at the overall number of outbreaks and the total number of staff and residents involved, that has been trending downwards substantively. And I think actually our long-term care sector and the outbreaks there is actually a very positive story around the benefit of vaccines. We have most of our long-term care residents have had a booster dose. So even though we've had a large number of, I don't have the exact number in front of me, a large number of residents who have been ill, we've had just slightly into double digits in terms of number of hospitalizations and even a lower number of deaths. So certainly, even though there's been a lot of illness amongst residents from COVID-19, there's been a very small percentage of them who have gotten ill enough that needed to be hospitalized, and I don't mean to diminish the deaths we've had, but the number of people that have died has been relatively small from a percentage perspective. The key reason to that is quite clearly the impact of the decision to provide booster doses of vaccine to our long-term care residents as soon as we were able to, and based on the NSLive recommendation. That has saved a lot of lives.
Next, we'll go to Paul Bacon from all Nova Scotia. Go ahead, Paul.
My first question is for Premier Houston. A few days ago, your Economic Development Minister met with business organizations who were looking for a beefed-up sector import support program. With restrictions easing on Monday, is that something your government is likely to pursue?
Pursue in terms of reevaluating the support programs? Is that the question?
That's the question.
Yeah, I mean, look, those discussions have been ongoing, and we listen carefully. We come up with the best suite of supports that we thought was necessary based on all the information we had. There will certainly be many people who would say more support is necessary, and there'll be many others who say it's just fine. But we built on the system that was been in place through multiple waves of the pandemic, and I think now as we start to ease restrictions and start to have a gradual methodical move forward, I'm hopeful that business owners will share in that optimism that we have, that we're moving forward, and that's the best possible outcome for everyone, I think.
Go ahead, Paul, with your follow-up.
And Dr. Strang, among the last restrictions, I guess, that will be lifted would be masking and the vaccine, the proof of vaccination. Can you explain why those will be towards the end?
Well, while there's still lots of virus circulating, we know that masking is critically important to help minimize the spread. When you bring more people together, masking has a significant impact on reducing the amount of virus and the ability for the virus to be transmitted. The proof of vaccination, we know that still has some impact around the spread, even though against Omicron, vaccine is only modestly effective against preventing infection. It's still we're in the range of 35 to 40% vaccine effectiveness. That's still a lot better than having zero protection and zero effectiveness if you're unimmunized. So it does contribute to decreasing spread. But even more importantly, we know that vaccination, people who are vaccinated, even with 2 doses, are still well protected against severe disease and are very well protected if they have a booster dose. So as we bring more people together, there is increased risk of transmission for sure. But as we bring them together, if we maintain the proof of vaccination, at least for the first couple of phases, what we're doing is substantively helping protect the healthcare system by as we bring people together, requiring proof of vaccination minimizes the chance of anybody from that gathering getting affected and getting severe illness and ending up in hospital. So keeping proof of vaccination now becomes a very important tool as we open things up to keep people out of hospital from a COVID infection.
Next, we'll go to Pat Healy from the Laker. Go ahead, Pat.
Hi, Dr. Strang. If you have a child, say 5 to 12 years old, that tested positive for COVID before their scheduled first vaccine dose, how long should they wait before rescheduling?
Some of the question, can you repeat that again? It was a bit faint, Pat.
Okay. If you have a child 5 to 12 years old that tested positive for COVID before their scheduled first vaccine dose, how long should they wait before rescheduling?
So the advice from NACI is that people who haven't begun or still in the midst of their primary series, they should wait 2 months from the time of when they were diagnosed with COVID to then continue continue their primary vaccine series.
Go ahead, Pat, if you have a follow-up.
Yes, I do. Dr. Strang, with the news today of the reopening plan, can planning begin by schools for a return to normal graduation and proms with full capacity at larger venues for this June?
I see absolutely no reason why schools can't start to make those plans. I'll be very happy to see those types of graduations in June.
Next, we'll go to Lois Andort from the Guysborough Journal. Go ahead, Lois.
Yes, hello. Thank you. Can you hear me?
Lois, go ahead. All right, we'll see if Lois connects again. We'll go to Tim Bousquet from the Halifax Examiner. Go ahead, Tim, if you're there.
Hi, Dr. Strang. I wonder if you can help us, the public, kind of think through the death issue a bit. Recognizing that we're doing this balancing act between the cost of restrictions and the risk of death and COVID, still it does strike some as complex. I'll say that you're announcing easing of restrictions on the same day that 5 people have died. 25 people have died since the last briefing. Are we to expect another 25 to die in the next 2 weeks? And on the path to endemic, there will be some level of ongoing death, I suppose. And what does that look like in the long term?
I mean, I'm not going to speculate on what that looks like in the long term. Part of moving to living with COVID is accepting that, in fact, we now have another respiratory virus that for some people, will, because of age and underlying health conditions, may put them at risk of severe disease, ending up in hospitalization, or may contribute to their death. That is no different than what we have with whether it's influenza or a whole range of other infections. We have to return to for longer term sustainability, the ability for COVID. Most people are not, when they're vaccinated, are at low risk of severe disease. There are some people that are at much greater risk. So for me, what this calls on, we have to lift the restrictions, and we'll be talking more about this in the coming days over the next week or so, as around for those who remain at increased risk, what do they need to do to keep them, to build in layers of protection, but as much about what is for the rest of us, what are our obligations about starting with us getting vaccinated. us taking more precautions when, say, we want to visit an elderly relative or a friend or somebody that may be in our classroom that has an underlying health condition. What things are we prepared to do to make sure that they have some layers of protection around them? But I think it's a fundamental point that that we need to make, that it can't be all about just ourselves. We have to be aware that there are others around us in our communities that are at increased risk, whether it's COVID, whether it's flu, whether it's a whole range of other things. And that I would like to think that what we've learned from COVID is that we need to be more aware of how all of us can contribute to protecting those who are most vulnerable. And that, to me, is the fundamental piece that we need to understand around vaccination. Vaccination is what you do to protect others around you, and I want those who aren't vaccinated to hear that.
Go ahead, Tim, with your follow-up.
Yeah, I guess along the same sort of lines, but not as drastic, I guess. On the march towards endemic, there's been kind of a limiting of those who have access to PCR testing. And I'm wondering, given the lower numbers now of positive cases and testing, could PCR testing be opened up to a broader part of the population, or is that just something that's going to decrease over time as well?
So we're actively looking at, today is about restrictions. We're actively looking at the other components of our response, whether it's testing, our case and contact management, and the surveillance, which goes along hand in hand with testing. So we're looking at that, and we'll be talking more about how we evolve those into this living with COVID, along with lifting restrictions. And so we'll have more to say in the days and the next couple of weeks around how we evolve our testing strategy specifically.
We'll try to go to Lois Ann Dort again to see if she's there. Lois, are you there?
Yes, I am. Can you hear me?
Yep, go ahead, Lois.
Yes, hello. Thank you. One question I have is, in data published by the Canadian Institute for Health Information for Long-Term Care Facility Ownership in Nova Scotia for 2021, it appears that almost half our private for-profit centres. Will the announcement on wages for CCAs affect those homes?
Yeah, so thank you, Lois Ann, for the question. And essentially, if a CCA is working in a home that's funded by the government, then this raise will flow through to them, and that's the vast majority of CCAs in the province.
Go ahead, Lois Ann, if you have a follow-up.
Yes, I do. Thank you. There was an announcement the other day about delayed diagnosis and treatment of cancer within the province due to COVID. Is the province keeping track of what is going to end up being collateral damage due to COVID, both for cancer patients and other people with other serious illness?
So my understanding is that our cancer care program and other kind of programs of care are certainly aware and are looking at some of those impacts and quantifying them and coming up with plans about how to address them as soon as they're able to. That's why it's important that we focus and not put more pressure on our healthcare system over the next couple of months, so we can start to reopen those other programs of care as soon as we are able to.
And that's all the time we have for questions today. Go ahead, Premier.
Thank you, Tina. Thank you, everyone, for the questions. I know the reopening plan for some people will be too slow, and for others it'll be too fast, and they'll be a little bit nervous about that. But I want Nova Scotians to know is obviously this is a balance, and it's one that Dr. Strang and I constantly consider. We consider it and talk about it each and every day. Public health not only has to consider the impact of the virus on our physical health, but it also has an obligation to consider the mental well-being of our province and the impact of lockdowns and restrictions on Nova Scotians. Public health and Dr. Strang are looking at the whole picture, and they're giving advice they feel is beneficial to the majority of the public. And those are the restrictions and reductions of restrictions that we want to move towards. So for anyone asking if this is the right thing to do, I just remind you, trust the team at Public Health who have taken us through this far, who have led us through the pandemic. And with Valentine's Day coming up on Monday, Just a reminder to Nova Scotians to think local when making purchases. Our small businesses have certainly been hit hard by COVID, and I'm also sure that more than a few spas would be happy to sell some gift certificates right now. I encourage everyone to show their local businesses some love as we move forward, and certainly as we move forward into Valentine's Day. But thank you for your patience, and thank you for your cooperation with public health measures. Thank you, everyone.
A hero by someone's side is a comfort in the word you'll be alright. What makes a hero to those afraid is the one who faces danger every day. What makes a hero in this story is you who sacrifice but want no glory. What makes a hero do what they do is everything I see in you. A hero for those who pray are the hands that offer hope for one more day. What makes a hero in a fight for life are the hands that offer hope for one more night. What makes a hero to someone helpless is you who risk your life for someone else's. What makes a hero do what they do is everything I see in you. You're my saving grace when I fall apart, the only light that shines when the world gets dark. You make me feel safe. You make mountains move. You're the reason why we're going.
guys feeling? Feeling good?
The British way.
Oh yeah, anybody gets the sociable.
It all depends on how well the fermentation is going.
I love them. You're gonna love them too. This is Brian from NSLive.tv.
That's a major accolade. I mean, to perform with the nylons.
The funds raised stay here in Nova Scotia and allow us
Maybe then they'll listen to what you have to say.
Well, this is the Great Gatsby Gala, and it's all in support of the Annapolis Valley Honor Choir.
I'd say cream sauce, but it's not going to be a creamy sauce around the plate. It's going to be like a thick kind of shield.
Tires, the cleaners, accessories, anything you can imagine for your car or vehicle, they got it right here.
And very delicious.